As a nation, we've taken some huge strides forward, and we can make careful further progress today, and we must remain vigilant. I can report to the House that there are now fewer than 1,000 people in hospital in the United Kingdom with coronavirus, and the average number of daily deaths is now 9. This progress means we're able to take step 3 in our roadmap today, carefully easing some of the restrictions that we've all endured. People have missed the things that make life worth living, businesses have endured hardship, and everybody has made sacrifices. And while we can take this step today, we must be humble in the face of this virus. We've all learned over the past year that in a pandemic, we must look not just at where we are today, but where the evidence shows we may be in weeks and months down the track. The vaccination programme can give us confidence, but we must be alert to new variants that could jeopardise the advances that we've made. Today, Mr Speaker, I'd like to update the House on the work we're doing to tackle variants of concern. In particular, variant B1617.2, which is the variant of concern first identified in India, so that we can protect the progress that we've worked so hard to achieve. There's now 2,323 confirmed cases of B1617.2 in the UK. 483 of these cases have been seen in Bolton and Blackburn with Darwen, where it's now the dominant strain. Cases there have doubled in the last week and are rising in all age groups. In Blackburn, hospitalisations are stable, with 8 people currently in hospital with COVID. And in Bolton, 19 people are now in hospital with coronavirus, the majority of whom are eligible for a vaccine but haven't yet had a vaccine. This shows the new variant is not tending to penetrate into older, vaccinated groups, and it underlines again the importance of getting the jab, especially, but not only, amongst the vulnerable age groups. Madam Deputy Speaker, Mr Deputy Speaker, Mr Deputy Speaker, in Bolton and Blackburn, we've taken the approach that worked in South London against the South African variant. We've surged in our rapid response team, 100 people so far, who this weekend visited around 35,000 people to distribute and collect tests. We've installed 6 new testing units, we've brought in over 50 new vaccinators and set up 2 new vaccination centres, as well as extending opening hours and capacity at our existing sites. In Bolton, we've quadrupled the rate of vaccination. We carried out 6,200 vaccinations over this weekend, and it's brilliant to see so many people from the most vulnerable groups coming forward to get the protection, whether it's coming forward to get the first jab or coming forward to get their second jab. All in all, this is the biggest surge of resources into any specific local area we've seen during the pandemic so far. It's been coordinated by Dr. Jenny Harries, the Chief Executive of the new UK Health Security Agency, drawing on all the health capabilities, locally and nationally, that we've built in the last year. I want to thank everyone who's working so hard to make it happen, including everyone at the 2 local authorities, the rapid response team, all the volunteers, including from St John's Ambulance, and most importantly, the people of Bolton and Blackburn for the community spirit they're showing. It's been really heartening, I'm sure the whole House will agree, to see the videos that have been published over the weekend of people queuing up to get the jab. And to anyone who feels hesitant, not just in Bolton or Blackburn, but to anyone who feels hesitant about getting the vaccine right across the country, just look at what's happening in Bolton Hospital, where the majority of people in hospital with coronavirus were eligible for the jab but have chosen not yet to have the jab and have ended up in hospital, some of them in intensive care. Vaccines save lives, Mr Deputy Speaker. They protect you, they protect your loved ones, and they will help us all get out of this pandemic. Mr Deputy Speaker, this isn't just about Bolton and Blackburn. There are now 86 local authorities where there are 5 or more confirmed cases. The next biggest case of concern is Bedford, where we are surging testing. And I would urge everybody in Bedford to exercise caution and engage in testing where it is available.